Welcome back, everyone. Continuing with his special Women's Health Series, Dr. Scot Ackerman, one of the First Coast leading oncologists, is focusing today on women in their 40s. So nice to see you again, Dr. Ackerman.
Thank you.
Talking about a subject very near and dear to my heart. So let's talk about some of the changes that are happening to women in their 40s.
Yep, well, welcome.
I'm almost done. I'm on the underside.
Well, next week we're going to talk about women in their 50s.
Oh, good. Then I'll get to know what's coming.
You can learn now and get ready. But last week we talked about women in the 30s, and this week we're going to do women in the 40s, and as I said, next week we'll do women in the 50s. So what's happening in your 40s is that a lot of things remain the same, as we talked about in the 30s. Metabolism begins to slow down, your skin starts to age, the collagen isn't quite as youthful as it was before, so you start to get a little bit of wrinkles. Your muscle mass begins to decrease. And that we talked about in the 30s. But the one major change in your 40s is that this is when estrogen levels start having a measurable drop. And what this causes, the lower estrogen, you're getting to this perimenopausal period. Now, most women go through menopause in their early 50s, but it could start sometime in the late 40s. You could start having lower levels of estrogen and having some symptoms associated with that. Typical symptoms include hot flashes, fatigue, mood swings, that sort of thing. Also, with lower estrogen, you begin having some bone loss. We talked about even in your 30s you get a little bit of bone loss, but starting in your 40s, then you're starting to see some acceleration of that bone loss to the point where in the 50s we recommend that women get their bone levels assessed.
Well, other than Botox and yoga, what else should we be doing in our 40s?
Well, Botox and yoga are very nice. The yoga part's the best part.
Okay, good. I've just started yoga.
And the Botox is good too, actually. You know,
you mentioned those wrinkles. You got to deal with those.
There's nothing wrong with Botox. It's great. It gets rid of those wrinkles. But yoga is better because yoga is exercise, and this is something I talk about a lot. Exercise is good. Exercise will keep your body mass index proper. That'll help you to reduce your risk of heart disease. That'll help minimize certain cancers. That'll help to make sure that if, God forbid, you did get sick, you would be in good shape to combat that. And also exercise in and of itself helps combat bone loss. The hormones that are excreted when you exercise facilitate the incorporation of calcium into your bones. Also, if you smoked, quit smoking. Now's the time to quit smoking. Also, if you drink, limit the amount of alcohol. Nothing's wrong with a few drinks a day, but excessive amounts of alcohol are associated with higher levels of breast cancer and some other cancers as well.
It's so interesting because sometimes you hear wine is good, then don't do too much wine, or this. It's a little confusing.
It is good. It's good in moderation.
Okay, good.
Wine and alcohol are good to keep your.
We got an okay for Botox, for wine, for yoga. This is good. See, this is good. People thought we were going to talk about bad stuff in your 40s.
I'm a feel-good kind of guy. You know, it's good for your heart. Wine, red wine especially, is good for minimizing heart disease. It keeps your brain sharp. Yoga's great. It's all good stuff.
So I also heard about your core. It's really important to have a strong core as you age for balance reasons.
Absolutely. Also, having a strong core builds your muscles. You know, when a lot of people, women especially, like to do a lot of aerobic exercise. They're running or they're on the elliptical, that sort of thing. Aerobic exercise is great for maintaining weight because you're burning a lot of calories, but it's not good at building muscle. And you need to have muscle, you need to develop muscle mass so that you can so that your bones get stronger. That extra muscle mass makes your bones stronger as well.
And let's talk about some of the supplements or other things you can do for bone, because my mother does have like a bone issue, so I'm assuming that may be something that's hereditary.
Yes, absolutely, absolutely. So in addition to exercise, which will be good, you can take some supplements. Beginning in your 40s, add more calcium to your diet. Look at your vitamin D. You may want to supplement with some vitamin D. I do. I take vitamin D every day. Milk, yogurt, salmon, sunlight, all these things have vitamin D in them, and milk and yogurt have calcium as well. I recommend that women in the 40s find a way to incorporate a gram or 1,000 milligrams, a gram of calcium into the diet daily. And they can do it through milk or yogurt. You can read on the package how much there is. If there's not enough there, you can take some calcium supplements and vitamin D, anywhere between 400 and 800 international units of vitamin D. You can get that with sun, you know, not too much sun.
Yeah, because then you end up needing more Botox.
Right, exactly. Or just take a vitamin D supplement, because the way it works is you want calcium in your bones for them to be strong. What vitamin D does, vitamin D helps facilitate the absorption of calcium into those bones. So you really need both. You can't just have one or the other.
And let's wrap up with screenings, because there's a lot of controversy about when you need a mammogram. But once you get into your 40s, what are the things you need to have?
Well, as I mentioned last week, continue with those screenings we talked about. Breast self-examination, skin examination. Make sure you continue seeing a physician for your pap smear and your pelvic examination every year. But now you should start looking at monitoring your blood glucose and your cholesterol. You want to have a good baseline for that, as I said before, too. But now in your 40s, add mammograms. Once you're 40, mammogram every year. If you're at high risk, maybe start that when you're 35, not when you're 40, but talk to your physician about it. But mammogram is the thing to add when you're in your 40s.
And at risk would be if you have a family history.
Yes, family history of breast cancer, mother, aunt, that sort of thing.
Okay, all right. Thank you, Dr. Ackerman.
Thank
See,
you.
this was a good chat.
It's always a good chat.
Thank you for the information, for sponsoring this segment. And of course, if you have any questions, this topic, or any other health issues you might have, visit Dr. Ackerman's Facebook page, facebook.com/First Coast Oncology. It is a great Facebook page. They show you also what's going on in this behind the scenes at First Coast Oncology. It's one big family over there.